just going to take a moment to provide some quick demonstration with the concepts of specific treatment, right? So we've spoken about that specific treatment is generally guided by two concepts. Macro identifies micro, big movements identify small problems, which allows us to identify it, but then also position for correction. So macro identifies micro is one of our assessment concepts, but it works for specific treatment as well in that it allows us to position for correction and then relational motion. So one of the concepts I'd like to try to demonstrate here is how specific treatment or treatment aimed at a very specific area often doesn't necessarily look like that. Sometimes it will look like a broad treatment or a large treatment or a treatment that uses a lot of things or a lot of points of leverage. So if we were simply to look essentially in and around slightly inferior to the ASIS and look at the hip flexor tissue or rectus femoris and some of the other quadriceps in the way that they attach, we could work on this, right? So it could look like, just I grab it and I work right there, right? Now for most people, that's going to be somewhat uncomfortable. So specific treatment to that could simply look like holding that muscle mass and working perpendicular to fiber direction or at 90 degrees to fiber direction. However, to work on the same tissue in a manner that's very specific, I can use leverage to help me, right? So I can come into a generally hip flex position to soften that tissue, and then it could look like this. Now, most people, when you see this, if you're not paying attention to where the hand is and how the hand is being deployed, and you may not see it perfectly on the video, but this treatment, right, and I can even start to add in activating forces, so compression, relative distraction, relative torsion, shear is somewhat difficult in this situation, but I can start to really get very specific to that soft tissue using mixed leverage, using activating forces. Now this can look broad. This can look like it's broadly for the hip. If I have to push across for whatever reason to do what I want to do to this tissue, it can look like I'm starting to work into the lumbar column, trying to broadly rotate the pelvis. But what you don't necessarily see, depending on how you're viewing this, is that it's very specific to the soft tissue just inferior to the ASIS. If we were to look at the knee, right? If the patient happens to be in supine, which in this case they are, if we want to flex the knee, we're going to have a hard time, right? So in order to flex the knee, we have to lift the leg off the table. Right? Now to work on the knee, I can work on it down here, right? But in supine, when I work on the knee, generally speaking, I come into relative hip flexion. So if I'm working on the knee, right, and I want to create knee flexion, this can then look like hip flexion. So this could look like I'm working on the hip. Although, because of where my hand is, I'm working very specifically in and around the knee, trying to deploy treatment as is necessary, right? So distraction, using wedges, right? Using a bigger wedge, working specifically on the head of the fibula or the fibular head, right? It won't be necessarily visible because of the angle here, but I can work here, right? Put a yoke in, work very specifically on that, although it looks like it's in a larger treatment. So we still have a relational motion. In a relative sense, the femur stays still, the tibia and fibula move in relation to it. We have position for correction, right? So I want to position to correct and go into knee flexion. So I need to come into a slightly different position when the patient's in supine. I need to lift the leg. Working on the ankle ends up looking quite specific, right? So I can have a yoke over the talus, start to work through there, but I can also work on the ankle here, right? So again, we have positioning for correction, and then we have relational motion working at the same time. But sometimes when you see a large motion, it may be hiding a more specific treatment. So again, macro identifies micro. That large motion allows me to get into the smaller part. Sometimes that small motion that's dysfunctional is really hidden in a larger motion, therefore we can use it to our advantage.